Seniors, if your stool looks like this, it could be a sign of cancer. Stop. Before you perform that routine act of flushing your toilet another time, it is critically important that you pause and absorb the information I am about to share. What I am about to reveal could very well be the decisive factor between detecting cancer in its nascent, treatable stages and discovering it far too late when medical interventions are tragically ineffective. My name is Dr. Robert Harrison, and throughout my extensive career spanning several decades in the practice of medicine, I have sadly encountered an innumerable number of patients who have sat before me, their bodies ravaged by advanced cancer, uttering the same heart-wrenching words. Doctor, I noticed something strange several months ago, but I dismissed it, thinking it was nothing significant. I sincerely wish I had sought your advice sooner. Right now, your body might be desperately sending you a warning signal, a subtle plea for attention, and with each passing day, you are inadvertently discarding the evidence, flushing it away without a second thought, without even taking a moment to truly observe. What emerges from your body is a profound and literal indicator of what is transpiring internally, often weeks, months, and sometimes even years, before you begin to feel unwell, before the onset of physical pain, and long before any standard blood test can detect an anomaly. What causes me the greatest concern, the aspect that truly frightens me, is that the most lethal forms of stool abnormalities, those that can signal the presence of advanced cancer, do not always manifest in an obviously alarming manner. Sometimes these signs are remarkably subtle. Occasionally, individuals might notice something a little unusual, a fleeting thought of, "That's a bit odd," only to then dismiss it from their minds. However, there is a crucial truth that fuels my hope. If you are equipped with the knowledge of what to look for, you possess immense power. You have the capacity to identify these potentially deadly warning signs at an early stage, when treatment is typically straightforward, and survival rates can exceed an impressive 90%. Your toilet bowl, in essence, is providing you with a free daily cancer screening, but this invaluable service is only accessible if you understand how to decipher the signs it presents. Today, I will meticulously guide you through precisely what you need to observe, and, more importantly, what you must never, under any circumstances, disregard. Something as seemingly simple as the color of your stool can already convey a wealth of information about the health of your bile ducts, the functionality of your liver, the well-being of your pancreas, or even the presence of internal bleeding that remains imperceptible to your senses. Furthermore, the shape, texture, and overall consistency of your stool can offer critical insights, ranging from the detection of parasitic infections and inflammatory conditions to the potential presence of cancerous growths. And as we conclude, I will equip you with 3 uncomplicated strategies designed to fortify and protect your gut health starting from this very day. To ensure clarity in understanding these vital indicators, we physicians utilize a standardized medical reference known as the Bristol Stool Scale. This scale categorizes the appearance of stool, classifying it on a numerical spectrum from 1 to 7, encompassing everything from extremely hard, pellet-like formations to entirely liquid consistency. I wholeheartedly encourage you to print this scale and prominently display it in your bathroom. There is absolutely no cause for shame in this practice. It is a valuable medical tool that empowers you to proactively monitor your own health status. If your stool consistently resembles type 1 on this scale, characterized by very hard, separate small lumps, akin to rabbit droppings, and presenting significant difficulty during bowel movements, this indicates constipation. In such cases, your intestines have retained fecal matter for an extended period, allowing it to dehydrate within your colon. This prolonged retention can lead to considerable discomfort during defecation, contribute to the development of hemorrhoids and anal fissures, and, more broadly, significantly exacerbate inflammation throughout your entire body. At the extreme opposite end of the spectrum lies type 7, which signifies completely liquid diarrhea. This condition indicates that your intestinal transit is occurring far too rapidly, preventing your body from adequately absorbing essential nutrients. What I want you to internalize and remember is this. Ideally, your stool should emerge in a formed yet soft, paste-like consistency. It should neither be excessively hard nor entirely liquid, and its color should be a healthy brown. When food journeys from your stomach into your intestines, it undergoes a process where it mixes with bile. Bile initially appears greenish. During the digestive process, this bile undergoes a transformation, gradually altering its color to bestow upon your stool its characteristic brown hue. Therefore, that familiar brown color is, in reality, a positive indicator of normal and efficient digestion. Now, here is an aspect that I find many medical professionals do not adequately elucidate. It is not sufficient for the form and color of your stool to appear normal. The frequency of your bowel movements is equally, if not more, important. Ideally, you should aim for a complete bowel movement on a daily basis, preferably occurring at roughly the same time each day. While some individuals naturally experience a bowel movement every other day, and if this has been your consistent, lifelong pattern without any associated discomfort or feeling of incomplete evacuation, it can be considered normal for you. However, when more than 2 or 3 consecutive days pass without a bowel movement, or if you observe any sudden and unexplained alterations in your typical bowel habit patterns, this should be considered a significant warning sign that warrants immediate attention. Changes in bowel frequency are not arbitrary. They can serve as indicators of various underlying issues, including intestinal blockages, hormonal imbalances such as thyroid dysfunction or the effects of menopause, prolonged periods of chronic stress, the side effects of certain medications, insufficient intake of fiber or water, or even more serious problems involving your liver or pancreas. Therefore, remember these 3 fundamental pillars of assessment: form, color, and frequency. These are your essential keys to understanding your digestive health. Let us now delve into specific concerning danger signs. Healthy stool should pass with a normal thickness, approximating the diameter of a mature banana. If you consistently observe your stool emerging as thin, narrow, or pencil-like in shape, this could be a warning that something is partially obstructing or constricting the passageway within your intestine. It is important to note that this does not automatically equate to cancer. It could, for instance, be a consequence of a low-fiber diet, the presence of diverticula in the intestinal wall, or an anal fissure that causes you to unconsciously tighten your anal sphincter during defecation. However, it can also, in some instances, indicate the presence of a growing tumor. If you repeatedly notice thin, pencil-like stools, particularly if this represents a departure from your normal bowel habits, it is imperative that you consult a doctor without delay. When you attend to your bodily needs in the bathroom, you should experience a complete sensation of emptying, that distinct feeling of relief and release in your lower abdomen. Many individuals, especially as they age, find themselves spending prolonged periods sitting on the toilet because they never quite achieve that feeling of complete evacuation. This condition is medically termed evacuatory dysfunction and is particularly prevalent among women following menopause. Another symptom that should raise concern is a persistent urge to defecate throughout the day, even after you have already had a bowel movement. This is known as tenesmus, and it signifies that your intestine has not fully emptied or that it is experiencing inflammation. For those struggling with constipation and seeking relief, I offer a specific recommendation. Upon waking in the morning, before consuming anything else, drink a full, large glass of water. This simple act helps to stimulate and activate your intestinal system. Throughout the remainder of the day, continue to drink another glass of water every 1 to 2 hours, ensuring you cease drinking approximately 2 hours before your intended bedtime. Furthermore, gradually increase your dietary fiber intake. Consider incorporating 1 to 2 tablespoons of chia seeds or ground flax seeds into your morning yogurt or oatmeal. Actively seek out fruits that possess natural laxative properties such as prunes, papaya, especially with seeds, kiwi, and apples consumed with their skins. A highly effective strategy I often recommend involves preparing a green juice blend incorporating celery, apple, and fresh ginger. Consuming 1 to 2 glasses of this juice daily can be highly beneficial, If diarrhea persists for a duration exceeding 4 weeks, this is classified as chronic diarrhea and necessitates a thorough medical investigation. In such instances, it is crucial to rule out conditions such as colitis, inflammatory bowel diseases, chronic parasitic infections, the presence of polyps, or other significant underlying intestinal issues. Persistent diarrhea can lead to dehydration and malnutrition, and it invariably points to an underlying cause that requires appropriate medical treatment. Regarding variations in stool color, if your stool appears green, this is generally not a cause for alarm. It often signifies that your food is passing through your intestines more rapidly than usual, thereby not allowing sufficient time for the bile to fully transform from green to its characteristic brown color. Alternatively, it may simply indicate that you have recently consumed a substantial quantity of dark, leafy green vegetables, such as spinach or broccoli. However, if your stool appears yellowish or a pale clay-like or whitish color, and this persists for more than 2 or 3 consecutive days, it could be a signal of impaired fat digestion, a parasitic infection, or problems affecting your pancreas, liver, or bile ducts. When considering whether stool floats or sinks, for many years there was a common misconception that floating stools were indicative of a serious underlying disease. However, contemporary medical understanding clarifies that the distinction between floating and sinking stools in isolation does not hold significant diagnostic value. Stools tend to float primarily because they contain a higher proportion of gas. What truly matters are the form, consistency, frequency of your bowel movements, and any notable departures from what is considered normal for your individual body. Now, we have reached what is arguably the most critical and potentially life-saving aspect of our discussion. What constitutes the single most dangerous type of stool? The most dire scenario representing a true medical emergency occurs when your stool exhibits a very dark, black appearance, reminiscent of tar or coal. This condition is medically termed melena, and I cannot overstate the seriousness of this symptom. Melena typically signifies significant bleeding occurring in the upper regions of your digestive tract, specifically within your stomach or small intestine. As the blood travels through your digestive system, it undergoes partial digestion, which imparts to it that characteristic black, tarry appearance. The underlying causes for such bleeding can include a bleeding ulcer in your stomach, hemorrhages from intestinal diverticula, small blood vessels within the intestine, or, in some unfortunate cases, internal bleeding stemming from an undetected cancer. The black, tarry appearance is a stark indicator that the bleeding is substantial and ongoing. If you ever observe black, tarry stools, it is imperative that you do not delay seeking medical attention. Do not rationalize by telling yourself you will contact your doctor tomorrow. You should proceed directly to an emergency room, or if it is during regular office hours, call your physician immediately. I have personally witnessed patients who postponed seeking care for black stools, and by the time they presented for medical assessment, they required blood transfusions and emergency surgical intervention. Please do not allow yourself to become one of those individuals. There is another color warning sign that demands urgent attention: bright red blood. If you notice bright red blood on your toilet paper, on the surface of your stool, or visibly mixed within it, this also warrants immediate medical evaluation. Bright red blood typically indicates bleeding originating from the lower portions of your intestine, your colon, or your rectum. In some instances, this bleeding may be relatively minor, stemming from conditions like hemorrhoids or a small anal fissure. However, bright red blood can also be an indicator of polyps growing within your colon. Polyps initially begin as benign growths, but certain types have the potential to develop into cancerous tumors over time. Furthermore, bright red blood can be a direct and unambiguous sign that colon cancer is already present. Blood in your stool, regardless of its color, should never be casually dismissed as merely a consequence of hemorrhoids. It is crucial to have it thoroughly investigated by a medical professional, which will likely involve a comprehensive examination and, most importantly, a colonoscopy. Now, allow me to present you with 3 powerful and actionable strategies that you can implement starting today to proactively protect and enhance your intestinal health. These are straightforward, sustainable habits that, if you commit to them, will profoundly improve your digestion, boost your energy levels, and significantly enhance your overall sense of well-being. Strategy. Number 1. Engage in physical activity every single day. If your daily routine involves prolonged periods of sitting or lying down, your intestinal system can become sluggish and less efficient. Your colon relies on physical movement to function optimally. Committing to a brisk walk of just 20 to 30 minutes each day, incorporating gentle stretching exercises, or simply remaining reasonably active during your household chores can make an enormous difference. Physical activity stimulates the natural rhythmic contractions of your intestinal muscles, which are essential for propelling waste material through your digestive tract. Therefore, make consistent daily movement a non-negotiable priority in your life. Strategy number 2. Schedule at least one colonoscopy after you reach the age of 50, even if you feel perfectly healthy. Current medical recommendations now suggest initiating colorectal cancer screening at the age of 45, and if you have a family history of colon cancer, it is advisable to undergo screening even earlier. Colorectal cancer stands as one of the most prevalent and potentially deadly forms of cancer. A significant characteristic of this disease is its tendency to grow slowly and silently. It is entirely possible for a tumor to develop over several years without manifesting any discernible symptoms until the cancer has reached a considerably advanced stage. Here lies the empowering aspect. Colorectal cancer is among the most preventable of all cancers. Nearly all colon cancers originate as small benign growths known as polyps. A colonoscopy provides the medical practitioner with the ability to identify and crucially remove these polyps before they have any opportunity to transform into cancerous lesions. In essence, a colonoscopy is a direct act of cancer prevention, not merely a detection method. If your colonoscopy yields completely normal results, you will typically be advised to repeat the procedure in 10 years. While the preparation process for a colonoscopy, which involves cleansing your colon the day before with a strong laxative solution, can be unpleasant, that single day of discomfort has the potential to literally save your life. Strategy number 3, and this is arguably the most potent of the 3, actively protect and nurture your intestinal microbiota every single day. Your gut microbiota is a complex ecosystem comprised of trillions of microorganisms, including bacteria, viruses, and fungi, all residing within your intestinal tract. When you actively care for this intricate ecosystem, it functions like a highly trained and vigilant army of protectors, working tirelessly on your behalf, 24 hours a day, 7 days a week. Allow me to elaborate on the critical roles these microorganisms play. They are instrumental in the breakdown and digestion of food, particularly fibers that your own digestive enzymes are incapable of processing. They are responsible for synthesizing essential vitamins, including vital B vitamins and vitamin K. They play a crucial role in strengthening and regulating your immune system, with approximately 70% of your immune system residing within your gut. Furthermore, they influence your mood and mental well-being by producing neurotransmitters such as serotonin, often referred to as the happy hormone. They also exert an impact on your body weight, metabolic processes, the level of inflammation throughout your body, your energy levels, and even your memory and cognitive functions. When your microbiota is healthy and balanced, you experience a general sense of well-being, possess ample energy, your digestion functions smoothly, and your immune system effectively safeguards you. However, when your microbiota becomes disrupted, a condition known as dysbiosis, your entire body can suffer. You may encounter a range of digestive problems, experience an increased susceptibility to infections, witness a worsening of chronic inflammatory diseases, suffer from mood disorders, experience unintended weight gain, develop brain fog, and endure persistent fatigue. How then do you effectively protect this vital ecosystem? Firstly, it is essential to avoid substances and practices that actively damage it. The single most significant culprit in disrupting the gut microbiota is the inappropriate use of antibiotics. While antibiotics are life-saving medications when truly necessary for treating bacterial infections, they are regrettably overprescribed, particularly for viral infections, against which they are entirely ineffective. Every time you take a course of antibiotics, you are not only eradicating harmful bacteria, but also indiscriminately killing off the beneficial gut bacteria. It can take weeks to months for your gut to recover from such an onslaught, and in some instances, the microbiota may never fully return to its original state. Therefore, it is imperative to only take antibiotics when they are absolutely necessary for confirmed bacterial infections and not for every minor cold or ailment. Beyond avoiding harm, you must also actively support your gut microbiota by consistently consuming probiotics and prebiotics. Probiotics are live, beneficial bacteria that you ingest. The most readily available and effective food sources for probiotics are fermented foods. Examples include plain, unsweetened yogurt that contains live and active cultures. Always check the product label. Kefir, a fermented milk drink, offers an even greater diversity of bacteria than yogurt. Fermented vegetables, such as sauerkraut, kimchi, and traditional pickles, are also excellent sources. Kombucha, a fermented tea drink, is another option. Aim to include at least one serving of fermented foods in your daily diet. Equally crucial are prebiotics. Prebiotics serve as the essential food source that nourishes your beneficial gut bacteria. They are a type of fiber that your body cannot digest, but which your gut bacteria can readily metabolize. When these bacteria consume prebiotic fibers, they proliferate and thrive. You can find prebiotics in a wide array of simple, everyday foods. Look for less ripe bananas, especially those that are slightly green. Apples, whole oats, brown rice, onions, garlic, leeks, asparagus, all types of seeds, and fruits consumed with their skins, along with a diverse selection of vegetables, all contribute valuable prebiotic fiber. The remarkable aspect of this approach is that you are not reliant on expensive supplements. You are simply consuming real, whole foods that have been a staple of the human diet for millennia, thereby feeding the beneficial bacteria that are instrumental in maintaining your health. This represents true preventive medicine, and you hold complete control over its implementation, starting with your very next meal. To summarize and bring this vital information into focus for you, actively caring for your digestive health and understanding its inherent warning signs extends far beyond mere intestinal well-being. It is fundamentally about safeguarding your overall health, ensuring a high quality of life, and, potentially, even preserving your very survival. Your digestive system is intricately interconnected with every other system within your body. When it functions harmoniously and efficiently, you experience a profound sense of overall well-being. My sincere desire is for you to feel empowered, not apprehensive, by this knowledge. Information is power, and you have now been equipped with the essential knowledge to effectively monitor your own health. By recognizing warning signs early and taking prompt action, you can prevent minor issues from escalating into serious health crises. Begin paying closer attention to your body's signals today. Every time you utilize the bathroom, take just a moment to observe. Cultivate this practice as a consistent habit. Your health is unequivocally your most valuable asset, and you possess more control over it than you may realize. Small, consistent actions, when performed regularly, compound over time to yield significant and transformative results. Do not defer prioritizing your digestive health until you are faced with a serious medical problem. Commence this crucial journey now, today, with your very next meal and your very next trip to the bathroom. I am Dr. Robert Harrison, and my purpose is to provide you with the information and the practical tools you need to take decisive charge of your health, enabling you to live your longest, healthiest, and most vibrant life possible. If you have found this video to be informative and beneficial, I kindly request that you share it with your friends, family members, and particularly with any loved ones over the age of 50 who would greatly benefit from this essential health guidance. Thank you for your time and attention, and I look forward to seeing you in our next video, where we will continue our collective journey toward achieving optimal health.